A heart attack is something when you block the artery, but before you block the vessel, there's often narrowing of these vessels. And that narrowing presents very subtly sometimes, because it has developed over 20, 30 years, that narrowing, slowly. But what we find is that you get short of breath when you're walking long distances, when you're climbing stairs. You get tightness in the chest sometimes when you're walking. And when you stop walking, the tightness and pain goes away. You walk a bit more, you climb stairs, you get this pain again. That is very, very classical of heart pain. The pain sometimes goes to your neck, it goes down your arm. It gets worse always on exertion, settling with rest. Okay, if you're having rest pain, we've got a problem. If it's heart, then it's something much more serious. So that's what you do: tiredness, shortness of breath on exertion, and pain when you're walking upstairs or exerting yourself that goes away with rest. That's classical cardiac ischemic heart disease. The other things to worry about is shortness of breath when you're lying down. You can't lie flat. Your legs are swelling up a lot, your legs get much larger, your shoes don't fit you. When you take your socks off, there's a little line there. These are things that could be in keeping with heart failure when the pump is not working well. The other cardiac conditions to worry about is palpitations. If you find your heart racing for no reason, not when you're anxious, not when you're running, but just you're sitting down and suddenly your heart starts racing. And a very useful thing is not just you feel your heart racing, but if you feel your pulse, you'll feel your pulse, it could also mean something is going on there as well. So the different things present differently, but the important thing to worry about is the chest pain. The chest pain going to your neck, going to your arm. If it's happening at rest or it's very severe with sweating and clamminess, get to a hospital, get an ECG. If it happens on exertion when you're walking, go and see a doctor or see a cardiologist. When there is narrowing of the arteries, it's a long-term thing. We cannot take the cholesterol away, we can't take the narrowing away. What we can do is relieve symptoms and make you better by putting little wires and pipes up into the heart, and then we put little balloons in and we can open up the narrowings, put little stents to keep these vessels open. That'll take away the pain and the tiredness, but in time, even these vessels will get narrow again and the stents will get narrow. The other thing we do is bypass surgery, where they have to cut your chest open and they use a vessel from inside your chest, they use vessels from your leg. If you've known anyone who had a bypass, they'll have scars on the leg as well, and they bypass the narrowings. But even that has a limited lifespan. So it's better to be preventative. Prevention is better than cure. So if you eat healthy, live healthy, have yourself regularly checked, control the risk factors, it's highly likely you won't end up on our table.